Good day, sir. I am Chris Badel Tayopon, your nursing aide for today. And today I will going to demonstrate administering a tube feeding. So the purposes of this procedure is to restore or maintain nutritional status and to administer medications of the client. Next, for assessment, um, we need to assess the following uh, clinical signs of malnutrition or dehydrations and allergies to any food in the feeding. If the client is lactose intolerant, we need to check the tube feeding formula. Then, notify primary healthcare provider if any incompatibilities exist. Then, the presence of bowel sounds, if there is, and if there is problems that suggest lack of tolerance of previous feedings, such as daily gastric emptying, abdominal distension, diarrhea, cramping, or constipation. Then for planning, we need to determine the type, amount, frequency of feedings, and the tolerance of previous feedings. And we need also to identify the materials, equipments needed for the procedure. We can bring it at the bedside of the bed so that we can save time and effort. And next, for implementation, introduce self, verify client's identity by using agency's protocol. So, good day, sir. I am Nurse Madel. May I know your name?
I'm Jonas.
Okay, thank you, sir. For the clients, identifying his identity, we can ask his name if he is present. But if the client is unconscious, we can check the hospital bracelet, ask the significant others if they are present also, and then check the chart of the client if to verify the patient's identity. Then afterwards, we need to explain to the client what we are going to do, why it is necessary, and how he or she can cooperate. And inform the client that the feeding should not cause any discomfort but may cause him to feel fullness. And next, assist the client into uh, Fowler's position, at least at 30 degrees elevation in the bed, but in the chair, it should be sitting position. And if the sitting position is not contraindicated, so slightly elevate right side lying position. It is acceptable if the condition of the client permits it. So, next, perform hand hygiene and observe any other infection control procedures, and provide privacy for the client. So we need to close the curtain around the bed or close the door if it was applicable, because tube feeding is embarrassing. So the client might not participate or cooperate with you if he or she is exposed to other people, because he can feel embarrassed. So we need to uh, uh, provide privacy to the client. Then perform dan gloving. Afterwards, we need to assist the tube placement. So the tubing is already attached, and so we need to attach the syringe to the open end of the tubing, and we need to aspirate to check the pH. Then after next, we need to place it to the pH. Then, allow 1 hour to elapse before testing the pH if the client has received medication. But for now, the client is not receiving, so we can test it to the pH papers. Then afterwards, we can place the stethoscope into epigastrium of the clients to hear the washing sound, so we can listen it while this is in his epigastrium. So we while administering the air, so we need to place or attach it to the end of the tubing. It should be 5 to 10 to 30 ml of air. We are going to listen for the wall whooshing sounds while administering the air to the tube. And after that, after listening the washing sounds, we are going to assess the residual content. So we need to aspirate all the contents uh, of the stomach before we are going to administer the feeding, to measure it, so that we can we will know later if how much, or the measurement that we are going to administer for feeding. So we are going to have the syringe. We need to aspirate. Then afterwards, if we aspirate 100 ml, so or more than half of the last feeding, if there is, so when withdrawn, so we need to check the nurse in charge to refer it to the agency, and before proceeding the feeding. So the precise amount is usually determined by the care provider's order, or by the hospital's policy or institution policy, because at some agency or institutions, feeding is delayed when the specified amount or the formula is remain to the stomach. So we need to know it. Then if the client is on continuous feeding, so we are going to check the gastric residual at least every 4 to 6 hours, or according to agency's instruction or to their policy, then administer the feeding. So before administering the feeding, we need to check the expiration date of the feeding and warm it if it is cold into room temperature, because excessively cold feeding may cause abdominal cramps. And when an open system is used, clean the top of the feeding container using alcohol before opening it. So we have to clean it. This minimize the risk of contaminants entering the feeding. So we need to clean it. Then afterwards, for syringe, the open system, we need to remove the plunger from the syringe and connect it to the syringe. Then pinch or clamp the gastric tube, because pinching or clamping the tube prevents excess air from entering the stomach and causing distension. Then we need to clamp or pinch. It should be like this. We can pinch it. Then add the feeding to the syringe barrel. So after that, we can add the feeding. It will be food or fluids. Then after that, we need to quickly administer feeding because it will flatus cramps or and vomiting. If the feeding is already flowing at the prescribed rate of it should be the physician's prescribed rate, then lower we need to lower the syringe or adjust the flows if needed, so that it will not cause any harm to the clients. Then pinch or clamp the tubing to stop the flow for a minute if the client experiencing discomfort. So, sir, are you alright? Do you experience something bad?
No.
Okay. Afterwards, if the client is alright or fine with it, so we need uh, to administer the feeding. Then feeding with bag open system. So we need to hang the label bag from an infusion pole about 30 to 30 centimeter long. It was 12 inches above the tube's point of insertion for the client. Then we need to clamp the tube and add the formula to the bag. Then we need to open the clamp, run the formula through the tubing, and reclamp the tube. Then we are going to attach the bag to the tube after hanging it. Then afterwards we need to attach it, but pinch first before administering, so that it will not going to it's not shocking if it was administered and the tubing is not kink or not pinch, so the administration is going through faster. So we need to pinch it so that it will not shock the flow in the tubing. And afterwards, if it was already attached, the feeding into the tube, we need to regulate the drip by adjusting the clamp to the drop factor that is administered or based upon the physician's order. So like 20 drops per ml, if not placed to a pump. Then afterwards, pre-filled bottle with drip, the closed system. So we need to remove the screw up cap from the container and attach the administration set with the drip chamber and tubing. And afterwards, after hanging the container on the intravenous pole, 30 centimeter, 12 inches above, so we need to squeeze the chamber 1/3 of half of the capacity, then open the tubing clamp